Hey everyone, welcome back to Medicine in the Making, where medicine meets meaning and future careers come to life. I'm Maya, your host, and in each episode, I sit down with rural healthcare professionals to give you guys the behind the scenes look of what it's really like to work in the medical field. And today, I'm so excited to welcome Dr. Odicie Fielder-Kimbrough to the podcast. She's a medical oncologist and hematologist based in Metro Atlanta, where she works with an HMO setting and brings years of experience and compassion to the patients she serves. What makes Dr. Fielder-Kimbrough especially inspiring is the way that she blends her personal story with her professional path, showing up for her community with empathy, cultural awareness, and a deep commitment to care. Outside of her clinical work, she's taken on leadership roles in healthcare systems, including her current position as a physician reviewer for utilization management. And I'm so excited to have her on the podcast today. So, my first question is, can you first describe what oncology and hematology is?
Yes, I can. I am double board certified in both specialties. So, medical oncology is the treatment of patients with cancer. And the medical part of it is that I am, the type of physician that mostly prescribes chemotherapy and other what we call systemic treatment. So, basically, medications for cancer. As a hematologists primarily treat blood disorders, which also can include blood cancers, but I also treat more benign conditions or non-cancerous conditions like anemia, sickle cell disease, and other blood disorders being common.
And my second question is, what first drew you to medicine, specifically oncology and hematology?
So that's kind of a twofold story in the making. When I was younger, my mother was a nurse. She was an LVN, which is sort of the certification below an RN. And in that role, she worked a lot in nursing homes. And basically, when I was a kid, my parents saw something in me and already saw that I was excelling in school at a young age. And so they basically told me that I had a couple of choices for careers. One of them was to be a doctor, or I could be a lawyer or an engineer, and that basically I was going to pick one of those fields and go with it. What happened along the way was that I started to say, well, I've always been kind of outgoing and more of like a people person. And of course, it sounded good that I wanted to help people. So that's how I sort of honed in on medicine really early. What I found along the way as I went through high school and started doing different volunteer experiences, also helping people, sometimes assisting like in the nursing homes and things like this, very basic things that, it was something that I was interested in and thought that I would want to do later in life. So I went into college, then as a pre-med major, and, things worked out that I enjoyed the science, all the science background that you need to go into medicine, and then eventually on to the clinical practice. Um, as far as the second part of that question, so specifically hematology and oncology, I'll be honest, initially I thought I was going to be a gynecologist. Again, I'm a female. So it was kind of the thing I knew. And I said, yes, I'm going to deliver babies and be a gynecologist. However, there was a lot of life in between high school and leading into medical school. And I subsequently lost both of my parents at pretty young ages to cancer. And I'm a believer that sometimes things happen for, specific reasons. And seeing some of the experiences, both positive and negative, that both of my parents went through on their cancer journeys drew me into oncology.
And would you say that those experiences that you had early on in life changed the way you approach your work today?
So I like to think so. I really do like to think so. I have the honor and opportunity to work in a community practice, as you mentioned. And so I have a very working class population in the metro Atlanta area. And I do sometimes see a lot of those patients. I see my family in those patients. And when I say family, not just my parents, but aunts, uncles, cousins, and all of the things. So, as I'm talking about sometimes very difficult, life changing, life altering things with my patients, I do think that it gives me like a special connection and bond and language that I can speak with them based on some of the experiences that I've been through.
Oh, that's wonderful. I know that the path can take a long time, especially for medical school. What did your path look like for getting, like, for training, for certifications, for medical school?
So I went to college for 4 years, and I went to UCLA, was where I got my undergraduate degree, and that was 4 years. Between undergrad and then medical school, I did take 1 year where I worked, and during that time, I worked in a chemistry lab at a local college. I then entered medical school and I went to Yale Medical School, where we have the requirement to work on a thesis project, which is, basically writing and completing a research and writing project with some expertise. So I did take an additional year to work on that thesis. I know that was also the year that I found out that my father was ill. And so I had that freedom to extend out that year of medical school. So I ended up subsequently graduating from medical school in 5 years and then going directly into residency in internal medicine, which was an additional 3 years. So I'll just stop there and say, so far, what is that? That's 12 years of education. Um, and then after my residency, I did the fellowship in hematology and oncology, which was an additional 3 years. I should also point out that in between residency and fellowship, I did work for a couple of years in a hospital setting doing general internal medicine. So again, sort of broke off of the traditional path.
And because you did have so many years in schooling, did you think that in the end it was worth it?
Definitely. One thing that I, always point out to younger students when I see them is that the years that you're going to school, college, medical school, residency, similar to high school, you're still living all of your life. All of the life things are happening. You make friends, you keep friends. Sometimes, as I mentioned, you may work and have different jobs. Yes, you're working really hard and you're studying really hard on the pre med track, but life is still happening. So I didn't feel like the day that I graduated from, let's say, fellowship, that I had kind of put my whole life aside and that I had only done medicine by that point.
So what would you say that the most rewarding part of your job is?
So I would say that it's the patient care and the relationships that I get to form with patients. Once I'm someone's oncologist, I'm usually with them through the entirety of their journey, whether that's that I cure them. And one day I say, okay, it's been 5 or 6 years since you had this cancer. I'm going to formally let you go back to your primary care doctor, or if I'm walking the journey with someone who is unfortunately going to be dying from their cancer or condition, and I'm sort of walking through that journey with the patient and the family. Both of those are rewarding to me because, as I mentioned from my own personal experience with my own parents, I try to be the type of oncologist that I wish that both of them had when they were sick. And I get to be that. So
Can you also explain how understanding a patient's background can change the way that you provide for their care?
So I think that some awareness and knowledge of a patient's background, and even if you're not as aware or knowledgeable about it, having inquisition and being inquisitive about someone's background and ultimately showing it respect can help you, especially in cancer care, can oftentimes help me get buy-in from patients who, let's say, for example, maybe they're coming from a culture where they don't necessarily believe in Western medicine, although they're in the United States. But being able to acknowledge and be inquisitive about like what their reservations are regarding the treatment that I'm offering them, and then kind of talk them through that. I do think that I have, helped some patients come over to what we call the Western medicine or traditional medicine side. I also think that cultural awareness and things can help inform how you talk patients through decisions, especially when, as I mentioned, I practice in the South. So we have a lot of conversations regarding religion and spirituality and how important that is. when you're treating the patient. And I think that patients are much more open to taking recommendations when they see or they feel that I respect whatever their religious beliefs are. And I can sometimes have conversations and engage them in some of these things that are particularly common, at least in the African American community, in regards to spirituality.
Yeah, and I know you said that respect and inclusivity are really important traits to have. What other traits do you think are necessary to work effectively with patients?
So I think that you have to be a strong communicator. I think that it's a plus to be an easy communicator, meaning that you have to want to talk to people and be curious about getting to know people. By the same token, I think that you also have to be a good listener. And an intuitive listener as well, because sometimes, patients will tell you things in indirect ways as well. So I think those are important traits.
And currently, what do you think a typical day would look like for you?
So most days I am in clinic seeing patients. So I have a set schedule of patients that come into the clinic, and usually I spend anywhere from a half hour to an hour with each patient, and usually their family, because I do encourage my patients to bring their family members to their visits if they're able. Some weeks I may go into a hospital setting and see cancer patients or patients with blood conditions. I see them acutely in the hospital. Those are not necessarily the same group of patients that I have the ongoing relationship with. That's more of an on-call setting, but I'm going in and I'm providing the acute oncology care in the hospital.
Yeah. What do you do currently in your role as a physician reviewer for utilization management?
So I did mention that I work for an HMO. So one of the beauties there is that I'm able to, under the same umbrella and the same organization, I provide my patient care, and that's broken off into time. So I spend 80% of my time doing that clinical care, and then 20% of my time, which is essentially 1 day a week, I do the physician reviewer role. Specifically, what I do is I review various requests that come through to the HMO or insurance side. So that ranges from, because I have the cancer expertise, I get asked many times about whether or not a cancer drug is appropriate, is the best and most what we call evidence-based care for a patient. But because I also have the training in internal medicine, the 3 years of residency, and some work experience in internal medicine, I'm also qualified and knowledgeable in internal medicine to review those insurance requests. So that could be medications, medical supplies that they're asking to be covered by the insurance. I do all those things. I talk with other physicians when there's complicated cases that come up and they're trying to figure out how to best utilize the health and the insurance resources. I provide consultation for that as well.
Yeah. And then what keeps you inspired during difficult or emotionally heavy times in your field?
That's a great question. I would say that maybe my biggest inspiration is again that it's not necessarily about me. It's really about providing the support and the resources for the patient. And what usually, especially when we start talking difficult and heavy, is usually probably the worst or hardest thing they've ever dealt with in their life. So, just knowing that I need to be there for someone else is what inspires me and keeps me going. I will also say that, to that kind of dives into self-care, that outside of medicine, I have grown much more intentional about making sure that outside of my clinical practice, that I am doing the things that fulfill me otherwise in life. And, that's my family, my husband, my children, my network of friends and organizations that I'm a part of. Those are the things that fill up my cup outside of work so that then I can go to work and pour into the patient.
What do you think the most surprising thing about your job is that people might not know?
So this could be a surprise to some, but that I am not getting paid any extra or any additional incentive to give patients chemotherapy. Um, yeah, I'm not getting some sort of like special pay for every time I give a patient chemotherapy, or some sort of, kickback from the insurance company or the drug company to give those drugs. So when I am there saying, I believe you should do this, I am telling them this information out of my medical knowledge that I trained a long time for, and what I believe firmly is the right thing to do.
Yeah, and then you also did mention how family and friends in your life are really important. How do you usually make time for that and work?
So I'm a mother of three young children. My oldest child is 12, and so the other two are younger than that. And children don't stop or wait. Every day I have a time that I say, okay, I have done the task required of me at work to the best of my ability. And I, now will go and give my children what they need with all of their activities and things. So it requires intentionality. I'm always planning my day out from the beginning. I know what my schedule is going to be. I have a time that I expect that I will be, getting home to then start my family life. And usually with children, they're waiting for you to get there. So that keeps me, accountable to getting back to my family every day.
Yeah, I think that's so important. And my last question is, what advice would you give a young student who's aspiring to become a doctor that may not see themselves represented in the field?
So I would start off by saying you can do it. That there are people out here, many people just like you, who have come before you and who have done it. Your biggest challenge would be to look out for those, to stay inquisitive, stay curious, stay motivated, so that you can find those opportunities, and those people who have opportunities can find you and help you along in your journey. I would also say that it's very, very important, especially I think in that college age, to find your people and find friends who have similar interests and motivations, and who you can not only have fun with, but who you can study with and who can motivate you to be your best self in those very, very critical years of your education. Um, and then, like I said, I would just always say, stay inquisitive. And if you work hard, then the opportunities and the success will be there for you.
Aw, that's great. Do you have any more final thoughts?
No, this has been a great platform. I thank you so much, Maya, for such great questions today, and the future of you all coming into medicine next.
Well, thank you so much again for joining, and thank you everybody else for listening to Medicine in the Making. And I hope today's conversation gave you guys a little bit more clarity, inspiration, or motivation into your journey into healthcare. And if you like what you heard, please follow the podcast, leave a review, and share it with someone who might need it. And you can also find more updates, guest highlights, and behind the scenes moments on my Instagram at Medicine in the Making. And until next time, remember to keep dreaming big, keep learning, and remember that the future of medicine starts with you.